Welcome back to MSNBC Live. I'm Carlos Watson. Now, just moments ago, my next guest unveiled the House Republicans' health care bill. Now, the GOP says their plan is much less costly than the Democratic bills, although House Democrats have not yet issued a bill of their own. But like Senate Democrats, whose bill was recently priced at over $1 trillion, House Republicans are not yet explaining how they would pay for their own proposal. Congressman Eric Cantor of Virginia joins me now live from Capitol Hill. And back here with me at MSNBC, Katrina vanden Heuvel. She's the editor and publisher of The Nation magazine. Congressman Cantor, good to see you, sir.
Carlos, good to be with you.
Congressman, so as quickly as you can, please tell me how your plan differs from the Democrats and why it's a better plan.
Well, number one, we start with the premise that health care in America is about choice, that if you like the plan you got, you should be able to keep it. And there is no way that we'll be able to manage that and stick to that principle if we inject a government plan into the mix. So that is the first tenet that we operate on. The next is, if we're really about trying to do something about the uninsured, we've got to do something different than what the Democrat plan in the Senate does, because as we saw this week, the Congressional Budget Office indicated that their plan would cost $1 trillion and frankly wouldn't even cover but a third of the uninsured. So if one of the drivers of this discussion is to expand access to coverage, we've got to come up with a way that, number one, rewards the ability for the private sector to innovate and to give folks more choice and at the same time keep down costs. That is what our plan does. It provides choice for those who want to keep the plan they have. It says no to a government plan. And then it goes in and it tries to create access to coverage for individuals through the creation of regional pools and larger access to affordable coverage and a basic plan.
Congressman Cantor, Katrina vanden Heuvel has a question.
Representative Cantor, first of all, don't you have a government health care plan? Don't representatives have these Cadillac health benefits? And secondly, if you're for choice, Republicans speak so well about choice and competition, how could you be opposed to a strong public plan so Americans can have the option and allow a real choice for them?
Well, first of all, I don't think that having a government plan is a real choice.
But you have one, don't you, Representative?
Well, I am under the Federal Employee Benefit Plan, and it is a plan that competes with other plans, and it is a plan administered by the private sector. It's much akin to the Part D part of Medicare,
which is a government plan,
which is certainly should be the model for us, because what that says is if we're going to create a larger risk pool, if we're going to have actual competitions within some type of government structure, that Part D should be the model. Again, how Part D has been successful and actually has demonstrated the ability to bring down costs in pharmaceuticals is it says, look, we're going to look to the marketplace to set prices. We're not going to have a price-fixing bureaucracy here in Washington that says that a certain doctor gets this amount and all doctors get this amount. We're going to say, look, let's listen to the market. Let's say this is the amount of money that plans have to work with and design the best plan that the market wants and the market will bear. In that way, if we stay away from prescribing what type of treatment, what type of care that people have access to, and let the market and families across America determine that, we can see a way to providing for more affordable health care.
But Congressman, haven't we just watched over the last year the unfettered market actually wreak havoc in a number of sectors? And do you not have concern that that's exactly what's happened in health care over the last 20 years? In fact, that's part of the reason why Republicans like Howard Baker and Bob Dole have joined with Democrats like Tom Daschle and George Mitchell to step forward. Is there no fear on your part that without some public intervention, some meaningful public intervention in the form of a public option, that we won't really lower prices and get all the uninsured covered?
Carlos, first of all, I don't think anybody in America thinks that Washington, either party in Washington, can reduce spending and reduce costs. It just hasn't happened. The history's not there. So rather than saying, well, the free market is in collapse here, we've got to go in and understand what does work in our economy. And what does work is innovation. If we create an environment for people to engage, to commit capital, and outline some very certain but limited rules by which to live and conduct business, and make sure those rules are understandable and certain, I think we can create an environment for private health care to continue in this country.
But Representative Cantor, I do think one innovation we might think about is that health care, affordable health care for millions of Americans, is a moral right. And an innovation would be to lock all of you up in Washington in one room and make sure that you come out with a plan that will cover the 47 million who are uninsured in America. Because what is true security but having a healthy, competitive country with health insurance provided with a public plan that I think millions, by the way, there was a conservative poll done the other day by business groups. 83% of Americans support a public option. And I think to deprive them of competition and choice is not the American way.
Hey, Congressman Cantor, I'm going to give you the final word, but we only have about 30 seconds. Your thoughts?
First of all, competition doesn't mean government competing. You will never have fair competition if government is a competitor. Look what's going on in the auto industry right now. With GM and Chrysler, they have a lot more competitive advantage now over Ford. You can't expect there to be fair competition if you have the government to be a player. And what we want, Katrina, is to give those uninsured Americans access to affordable coverage and coverage that they want. Most people in this country who have health care get it through their employer and like the plans they have. We won't be able to have that be the case if government comes in and begins to prescribe what kind of plans can be offered out there.
I don't think that's the case, but that's another argument, Representative Cantor.
But you know what, though? This is good enough that I hope you both will come back and we'll do it again next week. Congressman Cantor, thank you for joining us, sir.
Thank you, Carlos.